Actor Paul Ritter died on Easter, April 5th, 2021, from a brain tumor. Not much was said, but I imagine it was glioblastoma multiforme, one of the worst brain tumors you can get, but is not that uncommon. People usually don't live longer than 2 years after diagnosis, but there are a few people, less than 5%, that live beyond 5 years. Unfortunately, there's not much said about Paul Ritter and his brain tumor, his problems, and how he was treated. And that's a shame because there's so little known by the public about this problem. There really needs to be much more publicity about what can happen, how you treat it, and so forth. No one knows how you get this brain tumor. It just occurs spontaneously, and the first thing you might notice is a seizure where your body is just out of control, or you might notice numbness or other sensations or lack of sensations or pain in your extremities, or you might have problems talking, speaking, you may have a visual problem, and so forth. So really, you have to know the signs and symptoms to be able to get yourself immediately in to a doctor and have an immediate MRI scan to see whether or not you have a brain tumor. Speed is everything once you get diagnosed with glioblastoma multiforme, and what they'll do is set you up for a biopsy or complete removal of the tumor depending on the situation, and then they'll have a pathological diagnosis for you. Often it comes back grade 4 glioblastoma multiforme, because by the time it's diagnosed, it's already been there for quite a while, and it's been growing and advancing, spreading cancerous channels through the curves, lumps, and crevices of your brain, which are very difficult to remove. That's why after the surgery, this tumor requires radiation therapy in addition to chemotherapy. The radiation therapy has been advanced to proton radiation, where they can localize the cancerous tissue in the brain much more finely and deliver the radiation more directly to the disturbed tissue. This leaves the patient with less side effects so that they can possibly go about their regular activities a bit better. However, radiation is killing brain cells, and because these cancerous cells are spreading throughout the deep areas of the brain, it's impossible to get them all. So when you're diagnosed with glioblastoma multiforme, there's a huge chance you're going to have a recurrence. And in addition to radiation therapy, people are also given chemotherapy. Chemotherapy can better attack those insinuating cancerous cells because it's being delivered by the bloodstream, and hopefully that will help decrease the cancerous load on the brain. Again, this is going to form dead cells inside your brain, which your body is going to have to get rid of. That is going to cause some side effects. Might be fever, might be other things, but you can expect that you're going to have a recovery time which may be problematic, and you will need supportive help by a family member or by some more professional organization. I'm going to talk more on glioblastoma multiforme in another podcast.